Hi, my name's Brittany Dean, and I'm going to be doing my head to toe assessment. Go ahead and get started. Hi, my name's Brittany. I'm going to be the nurse today. We're going to go ahead and get your head to toe assessment done. Can you tell me your name and date of birth?
Jeremy Ward, 09/07/1988.
Alright, and do you know where you are today?
I'm at the hospital
Do you know why you're here?
for a checkup.
Good. Yeah, that's why we're here today. Alrighty, so I'm going to go ahead and get started. Have you had any memory loss or any forgetfulness lately? No? Okay. Have you had any head injuries?
Not recently.
Any facial or jaw pain?
No.
Okay, I'm going to go ahead and look at your scalp,
Okay.
see if we see any unusual moles or anything like that.
Okay.
It looks good. Now I'm just going to palpate your head, okay?
Okay.
Alrighty, no lumps or anything. So I'll go ahead and wash my hands again. Alrighty. So now I'm just going to get you to puff up your cheeks and make sure we have facial symmetry. And raise your eyebrows. Good. And now smile for me. Alrighty, that looks good. So now we're going to see if you can feel this cotton on your face, okay? Close your eyes and just tell me which side I'm doing it on.
Left.
Alrighty.
Right.
Alright, good. And so now I'm going to go ahead and palpate your jaw, okay? Alrighty, good. And now I'm just going to let you open your mouth, check out your TMJ. Alrighty, good. Now I'm going to ask you to remove your glasses. I'm going to feel for your temporal artery. Okay, good. Alrighty, it's equal bilaterally, so that's good. Now we're going to look at your neck, okay? Have you had any difficulty swallowing? Any stiffness or pain in your neck?
No.
Okay, so I'm just going to touch my fingers to your neck here. Alrighty, good. And then now I'm going to just feel for your lymph nodes. Let me know if you have any tenderness, okay?
Okay.
I'm going to go back to your occipital nodes. Any tenderness?
Mm-mm.
No. Okay. And down that. Come back up. Alrighty. Any tenderness with that?
Mm-mm.
No? Good. Okay. So now I'm just going to ask you to turn your head to the right. And then to the left. Good. And now look up. And then look down for me. Good. And now I'm just going to ask you to shrug your shoulders up and down. Good. And now turn your head to the left. And then turn your head to the right. Okay, good. Now I'm just going to listen to your carotid, okay? I'm going to listen for any bruise or whooshing noises. I'm just going to ask you to hold your breath so I can hear it a little better, okay? No whooshing noises. So now I'm going to go ahead and palpate. Do one side at a time. Good. Alright, that feels good as well. So now I'm going to go ahead and take a look at your ears. Have you had any ringing in your ears?
No.
Any drainage?
No.
That looks good. Good. So now we're going to look at your nose. Have you had any nasal congestion?
Yep.
You have. Is it because of your allergies or?
Yep.
Okay, good. And have you had a history of nosebleeds?
No.
No. Okay. So I'm looking at your nose. It looks very symmetrical, so that's good. And I'm just going to look up, okay? Perfect. Good. All right, so now I'm going to palpate your sinuses. Just let me know if you have any tenderness.
Okay.
Any tenderness? Okay,
No.
good. So now we're going to see if you can smell something real quick. So just close your eyes and let me know when you smell something.
Okay.
Do you know what that smell is?
Eucalyptus.
Good. Alrighty. So now I'm going to get you to close one nostril and inhale. Good. And the other. Good. And now I'm just going to check your oral cavity. How often do you brush?
Once a day.
Once a day. Okay, they recommend twice a day. When was your last dental exam?
It's been a while.
Okay. I'm going to go ahead and take a look in your mouth. Looks good. And now stick out your tongue and say, ah. Alright, good. Looks like your palate is moving up bilaterally, so that is good. And now I would go ahead and wash my hands and put gloves on and feel inside of his mouth, but since I don't have gloves, I'm not going to do that today. So now we're going to look at your eyes. Have you ever had eye surgery?
No.
No? Okay. Any vision changes recently?
No.
Okay, good. So I'm actually going to get you to follow my finger.
Okay.
Alright. Good. Wait, and now I'm just going to get you to follow my finger again. It's going to go in towards your nose. Good. Okay. Now I'm going to get you to put your hand between your eyes. And I'm going to shine the light in your eye once on one side, twice on one side, okay? Good. We're looking for consensual pupillary reflex. Good. Now I'm going to do the other side. Good. One more time. Good. Alrighty. And then one more time, I'm going to shine the light right between your eyes, okay? And you just look straight at me. Alrighty. The line shines right in the same spot on both people, so that is good. Now we are going to go ahead and take a look at your chest, okay?
Okay.
So I'm going to actually ask you to turn around. Alright, so now we're going to move on to your lungs, okay? So I'm just inspecting your back, and your back looks good. I don't see anything out of the ordinary. So now I'm going to put my hands on your back. I'm just going to ask you to take a deep breath, okay? Good. Alright. So now I'm going to go ahead and palpate your back. Now I'm going to percuss. Okay, good. So now I'm going to place my hand on your back and just let me know if you have any tenderness. I'm going to hit my hand, okay? Any tenderness?
No.
Okay. Now I'm going to go ahead and take a listen to your lungs, alright?
Okay. Do I need to take a deep breath?
Okay. And now go ahead and turn around so I can listen to your lungs from the front. gonna check your shoulders, or I'm gonna pinch right at your clavicle to see if you have any tenting or dehydration. You don't, so that's good. And I'm just gonna ask, do you ever do monthly breast exams? No. Even as a male, you should still do monthly breast exams, okay? Check for any lumps or anything.
Okay.
So now I'm gonna go ahead and listen to your heart. Have you had any history of hypertension or strokes? No. Any increase in heart rate lately? No, okay. I'm gonna go ahead and take a listen. I'm gonna listen with the bell, and I'm just gonna ask you to lean forward. Alrighty, no murmurs or extra heart sounds, so that's good. So now I'm going to just look at you from the side and see if I see any palpitations or anything like that. So just breathe normally. Right, and now I'm going to place my hand on your chest to see if I feel for any thrills or heat. Okay, good. So now I'm going to go ahead and palpate your arteries on both sides, okay? You can bend your elbows. Alright, I'm going to do your popliteal. Let's see. That's kind of weird. Alrighty, and your tibia.
Which one is that?
Your tibial. And your pedal pulses. Good. I feel them both bilaterally, so that's good. Now we're going to check your arms. So I'm just going to feel your arms and see if I feel any tenderness. Have you had any muscle or joint stiffness? Any injuries? No, okay. Do this one. Alrighty. That's good. Now I'm going to get you to turn this way. And put your arms out like this. And then pull towards yourself. Push towards me. Okay. Then put your arms straight out like that. Now push with your hands. And now pull back with your hands. And then I'm going to get you to splay your fingers. Okay, good. So now we are going to move towards, get you to lay down and look at your legs and your abdomen. So now I'm just going to go ahead and palpate your legs. Just let me know if you have any tenderness, okay?
Okay.
Any tenderness? No? Okay, now we're just going to test the strength of your legs. I'm just going to put some pressure on and you lift your leg. Good. Now lower it. Now lift it. Good. And the other side. Lift. Good. And one more. Alright, so now I'm going to put some pressure on the bottom and I just need you to lower your leg. Okay, go ahead. Good. And go ahead. Good. Same thing. Lower. And lower. Good. Alright, so now I'm going to look at your abdomen. I'm inspecting it. It looks good. I don't see anything out of the ordinary. So first I'm going to go ahead and listen to your abdomen, your bowel sounds, using my diaphragm. to use the bell and see if I can hear your aorta. Okay. There are no whooshing sounds, so I'm going to go ahead and percuss. Alrighty, and you said you did not have any pain in your abdomen, right? Okay, so I'm going to go ahead and palpate, do some light palpations. And have you ever gotten your Hep B vaccinations?
Yes.
Okay, good. So now we would also do a genitourinary exam with him standing, but we're going to not do that today. We would also do deep palpations, but we will not do that today. So now I'm going to get you to sit up, and I'm just going to check your reflexes. Now pretend this is my reflex hammer, so I'm just going to get you to put all of your weight into my hand. Good. Good. Put your arm out straight. Good. One more. Oh, that's not right. Okay. And same thing on this side. Good. Straighten your arm out. Now I'm going to check your patella reflex. So he would have his legs dangling so we could actually see the reflex, but I don't have a chair that's tall enough, so. Right, and then this leg. And then we're going to go right behind your heel. Good. Good. And now I'm just going to go to the bottom of your foot. It might tickle a little bit. Good. Alrighty. So now I'm also going to check the capillary refill in your fingers. Good. And your toes. Good. And then, let's see. I'm going to get you to follow my finger, or touch your nose and then touch my finger, okay? I'm gonna do some hand hygiene before I do that since I just touched your feet. Good. 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 And good. Okay, so now I'm gonna get you to stand up. Can you stand up for me? Okay, and then I'm just going to see if you can walk for me. If you'll just walk towards the wall normally. And then walk back heel to toe. And then walk back towards the wall on your tippy toes. Okay, good. And now I'm going to get you to sit back down. And I'm going to get you to take your heel and run it down your shin, just like that. Good. And do the other side. Good. Now I'm going to get you to close your eyes. I'm going to touch both of your sides and tell me if which side I'm touching, okay?
Okay. Left. Right. Both. Left. Right. Both.
Okay, that's good. And then I'm going to look at your spine. So if you can go ahead and stand back up. Sorry. And I'm just going to look at your spine. It looks central. So go ahead and bend over. Alrighty, that looks good. And then I'm just going to get you to close your eyes and stand straight. I'm going to put my hands up around you for balance. Alright, that looks good. I would also note that his respiratory rate and rhythm were all normal and his heart rate were normal. and within normal. And now that I'm done with the assessment, I would go ahead and document all my findings, let the doctor know if there were any abnormal findings, and I would thank my patient and ask him if he needed anything else from me and make sure that he was in no pain. All right, thank you.